Thanks to everybody who has been joining us today. We will get started shortly. Dave, if you could move to the next slide. I do just want to let folks know that you are muted and your camera is off, but we do want to hear from you today. So please, anytime during the presentation, if you could ask any questions, if you have any comments, go ahead and put them in the chat. We are also recording this video. The recording will be available shortly after the event, and we'll make sure to send that out to you in a follow-up email along with all of the resources that we present today. Closed captioning is also available. So in order to activate the closed captioning, just click on the CC icon and select Show Captions. And today we are also interpreting this event from English to Spanish. So if Spanish is your primary language, you can listen to this entire presentation in Spanish by clicking the interpretation icon and then selecting Spanish. So from here, I just want to briefly go over a little bit about the Health Foundation and about Pulse. So first, I'll start with introducing myself. My name is Austin Montoya, and I am the Senior Officer of Policy Advocacy Communications here at the Colorado Health Foundation. And really at the Health Foundation, our rally cry is to ensure that we're bringing health and reach for all Coloradans, and that we all have everything that we need in order to live healthy lives. And the way that we do that is by investing in communities, advocating for change, and listening to Coloradans and understanding them through our research efforts. About a little bit about Pulse. This is an annual poll that takes the pulse of Coloradans across a range of issues impacting health and well-being. It's about listening and hearing from people outside our own circles and gaining a greater understanding of how Coloradans are navigating today's challenges, whether it's affordable housing, food insecurity, or mental health challenges. And part of our commitment to racial justice, we do oversample particular racial and ethnic groups, including African Americans, Asian Americans, and Native Americans. And along with that, we also do a convenience sample in order to receive enough responses from Native American Coloradans. And so we couldn't do that really without the help of a lot of our partners listed here. And before I get into any more of this, I do want to pass it on to our wonderful interpreters from the Community Language Cooperative. And they will briefly tell you a little bit more about them and their commitment to language justice.
Good morning, everybody. My name is B. Torres. I will be one of your interpreters. I'm joined by my colleague, Valentina. We're here with the Community Language Cooperative, and we want to appreciate your commitment to language justice. Language justice means that everyone has the right to speak and be heard in the language of their hearts. Valentina and I will be providing interpretation from English to Spanish. To do this well, we would love for you all to remember to speak at a conversational pace so that we can provide an accurate rendition of your message. In a moment, or actually now, you should see the interpretation icon at the bottom of your screen. When you click on that icon, you'll see a pop-up that has you select either English or Spanish as the language of your heart. If you are fully bilingual in both languages, you do not need to select just one language. If you choose Spanish, please remember to mute original audio, and you will only hear your language being spoken. Hola, buenos días. Mi nombre es Vi Torres y yo estoy aquí con mi colega Valentina. Nosotras estamos aquí por parte de la Cooperativa Comunitaria del Lenguaje y les agradecemos su compromiso con la justicia del lenguaje, lo cual significa que todas personas tenemos el derecho de hablar y ser escuchadas en el idioma de nuestro corazón. La función de interpretación ya está activada. En la parte inferior de su pantalla puede ver un icono terráqueo. Favor de hacer clic en ese icono y elija inglés o español como el idioma de su corazón. Si usted escoge español, por favor haga clic en Mute Original Audio para apagar el audio original. Si usted está hablando hoy, por favor asegúrese de hablar a un ritmo de conversación para poder brindar una interpretación precisa de su mensaje. Muchas gracias. Ya continuaremos. Thank you. We can go ahead and continue.
Thank you so much, B. Thank you so much, Valentina. And thank you to CLC. They've been an amazing partner with the Colorado Health Foundation for many years now, and we really appreciate everything that they do for us. So with that, let's dive into the data. I will pass it on to Dave, our Democratic pollster here on the Pulse team, and then we will pass it on to Lori Weigel from Newbridge Strategies, a Republican pollster. Kick it off, Dave.
All right, thank you very much, Austin, and thanks to all of you for joining us today. We're very excited to release the latest information from this year's Pulse poll, covering a range of topics in addition to those that we discussed in our last briefing last month, which focused on the cost of living and housing issues. Today, we're going to take a look at Coloradans' attitudes toward government and take a deeper dive on some of their views of healthcare, as well as focusing on some issues relating to guns, the environment, and a range of other concerns that Coloradans expressed in the poll. But first, just a little bit of a reminder about the survey's methodology. Austin previewed this a little bit in his earlier comments, but with the Pulse poll, we try to be as rigorous and expansive in our sampling methodology as possible to ensure that we can represent the full diversity of Colorado's adult population. This survey was conducted over the course of the month of April, for the most part. The reason that there are two pollsters on the phone today, myself and Lori, is, as Austin alluded, we form a bipartisan team. My company, FM3 Research, when we poll on political issues, polls only for Democratic candidates. Lori's firm, Newbridge Strategy, polls only for Republicans, but the two of us have been working together for a little over 2 decades now, doing research that we both design and analyze from a bipartisan perspective on issues like the ones that we're going to be covering today. In order to make sure that our sample for the Pulse survey is as representative as possible, we speak to a large number of adult Coloradans. In this year's survey, over 2,600. We contact them by sampling a random set of residential addresses throughout the state of Colorado, reaching out to people with landline phone calls, wireless phone calls, email invitations, text messages, and even printed postcards that we send people to invite them to participate in either a telephone or online survey. And as Austin noted, we take care to oversample some segments of the population that, while smaller in absolute terms, we want to make sure we can understand with some statistical confidence in looking at the data. That includes individual communities of color within Colorado, as well as residents of Pueblo County. The interviews are conducted in both English and Spanish to ensure that language is not a barrier that prevents people from participating. And this year is the 4th consecutive annual survey that we have conducted for Pulse. Many of the questions we ask are repeated in each year's survey, which gives us the benefit of being able to track over time the way Coloradans' perspectives are shifting. These have been a pretty tumultuous 4 years for the Pulse survey to start. Our first survey was fielded in 2020, shortly after the start of the COVID-19 pandemic. And obviously there has been a lot of political, social, and economic change that has taken place over the course of the last 4 years. And we've been fortunate to be able to document some of the shifts in the way that Coloradans are reacting to it over that period of time. And we'll focus on some of those changes in the data that we share with you today. So first, just a sort of big picture look at a range of the issues that Coloradans tell us are concerns right now. We have a question that we've asked in every poll where we present the respondents with a list of issues facing Colorado and ask them to rate each one as either an extremely, very, somewhat, or not too serious problem. You'll see the responses ranked here by the proportion that rated each one either extremely or very serious. Those are the top 2 points in the scale, represented by the red and orange bars, and they're totaled running down the right-hand side of the slide. Now, as we noted in last month's briefing, issues relating to the cost of living and health and housing issues are the dominant concerns in the state. with upwards of 2/3 of respondents rating them all very serious problems. But beneath that top tier, the first 4 issues that you'll see on this slide, there is also substantial concern about issues including mental health, drug overdoses, crime, and gun violence. Each of those is an issue where a solid majority of Coloradans, at least 3 and 5 in most cases, rate it as a very serious problem. We'll talk a little bit more about healthcare a little later on. Lori will sort of dive more deeply into those responses. But the level of concern that we see about both crime and gun violence in this poll, I think, is noteworthy. As we move down the list, you'll see a range of other concerns that are prominent for Coloradans, including some that relate to the state's environment. We have almost 3 in 5 Coloradans that view wildfires or other natural disasters as being a very serious problem. This, despite the fact that last year's fire season was not as severe as some of those in the years immediately previous, and also a sizable number of Coloradans who are highly concerned about climate change. In fact, almost 1/3 of Coloradans rate climate change as an extremely serious problem. That's that dark red bar that you'll see on the left-hand side. Now, this question, as I noted, is one that we have asked repeatedly from year to year to understand how public opinion is shifting on a number of these issues. The big change we saw in this year's survey was an increase in concern about gun violence. That the proportion who rate it a very serious problem has gone up a full 13 points since last year's survey. The only issue where we saw a double-digit increase in concern from year to year. And that represents obviously a new high in terms of the level of concern we've seen in this survey. We started asking about gun violence last year in the 2022 survey. Also, some notable increases in concern about homelessness, mental health, police violence, and misconduct, issues that all went up by at least 5%, but not dramatically different from what we have seen over the course of the last couple of years. There were a few issues where we saw concern declining a bit over time. If you look at jobs in the economy, for example, the 4th item from the bottom, that was very high in our inaugural survey in 2020 during the pandemic, but for the last 3 years, we have seen significantly lower levels of concern about jobs in the economy as a issue writ large here. Now, on issues of sort of the issues about which Coloradans are most concerned, we do see some big partisan differences here in Colorado, as we do around the country. And we've highlighted some of the places where the gap between the concern expressed by Democrats and the concern expressed by Republicans is most prominent. Climate change is the one where we see by far the largest gap, a full 66 points between the concern expressed by Democrats and Republicans. More than 3/4 of Democrats, 78%, rate climate change an extremely or very serious problem. Among Republicans, that number is only 12%. And in fact, Republicans in Colorado rate it as the least serious concern of all the things that we tested here, independents falling somewhere in between. Colorado is no different than the rest of the country in this regard. That issue is one that has become a very polarized issue across partisan lines, and that's reflected in this data. But we also see substantial degrees of polarization around a couple of other issues, most notably gun violence. You remember that we saw those numbers increasing significantly in this year's survey. A lot of that is driven by Democratic and independent voters, where we have 3 and 5 or more rating it a very serious problem, only 1/3 of Republicans viewing it the same way. Conversely, there are some issues where we see higher degrees of concern among Republicans than we see among Democrats, most notably at the bottom of the slide, the issue of illegal immigration, where there is a 48-point gap between the concern expressed by Republicans at 62%, and then among Democrats at 14%. It's almost a mirror image of climate change, with Democrats ranking it as by far their lowest concern of all the issues facing Colorado. In fact, among the issues we tested, it's one of only 2 that fewer than half rated as a very serious problem, whereas for Republicans, it's in the top tier with 62% rating it very serious. Also worth noting at this point that there is a bipartisan consensus around a range of concerns, especially those that we talked about in our last briefing relating to the cost of living and housing, where there are minimal differences between Democrats, independents, and Republicans in terms of the level of concern that they express. We also asked our respondents, as we have in some prior surveys, to tell us whether they or someone they know has been treated unfairly in a variety of different contexts as a result of their race or ethnicity. As we have seen in prior surveys, a significant share of Coloradans say that they or someone they know has been treated unfairly on the basis of race when interacting with law enforcement. In fact, almost 3 in 10 Coloradans, 29%, indicate that they have had this experience, a significantly more common experience among Coloradans of color, as you'll see over on the right-hand side. In particular, Black or African-American Coloradans, Native American or Indigenous Coloradans, majorities, clear majorities, tell us that they or someone they know has experienced that kind of unfair treatment at some point. So moving past the sort of broad range of issues that we tested in the poll, we added a series of questions to this year's poll that we hadn't asked before about perceptions of state government. One of the striking findings in prior years' surveys was when we asked people in an open-ended question to tell us what they viewed as the biggest problem facing Colorado, we always have had substantial numbers who said that government itself, or government and politics, is something that they view as problematic. And in fact, in this year's survey, in that open-ended question, it ranked second only to the cost of living in terms of how frequently it was volunteered as a major concern facing the state. So in this year's survey, we wanted to add some questions to take a deeper dive and understand a little bit more about Coloradans' relationship with and perceptions of their government. So we started out with a pretty basic question: how satisfied are you with the state government in Colorado and how well it works for people like you? And as you'll see on the slide, we have a majority that tell us they are satisfied, 52%, compared to just fewer than half, 45%, who express dissatisfaction. But that is a pretty tepid and lukewarm satisfaction that Coloradans are expressing. Fewer than 1 in 5 indicate that they are very satisfied with the performance of state government, and that is less than half the proportion who indicate that they are very dissatisfied. So while there may be more positive sentiment than negative sentiment, there is a lot more intensity of feeling among those who are dissatisfied with state government's performance. And again, I would note that relative to research that we do in other states, this is not uncommon. We're in an era where there's a lot of cynicism about government at all levels. It attaches most to the federal government. That's where we tend to see the most dissatisfaction, but it's also present at the state level. And frankly, these levels of satisfaction are no worse and in many cases better than what we see when we poll in other states. Some of the biggest differences that we see in satisfaction with government's performance come along partisan lines. Democrats, by a margin of almost 4 to 1, tell us they are satisfied with the state government's performance, whereas Republicans, by more than 3 to 1, express dissatisfaction. Independent voters, by a 16-point margin, tell us they are more satisfied than they are dissatisfied. To some degree, this just reflects the sort of prevailing sentiment among each political party in terms of its attitude toward government. But I think it also obviously has a lot to do with which party is in control of state government. In Colorado, that is Democrats. And so, not surprisingly, Democrats are more pleased with the direction of the state and Republicans less so. When we look at some other distinctions in terms of satisfaction with government's performance, on this slide examining it by ethnicity and by household income, you will see a few differences that stand out here. There is a lower level of satisfaction with state government's performance among Coloradans in households with lower levels of household income. Those with incomes under $30,000 per year, a majority expresses dissatisfaction, which is distinct from the other income cohorts that we're looking at here. And you will see in general a little bit broader satisfaction with government's performance among Asian and Pacific Islander Coloradans, Black and African American Coloradans, and Hispanic Coloradans, where we have clear majorities who indicate satisfaction with the way that state government is meeting their needs. Now, we also asked a question that was similar to the one I shared a moment ago about law enforcement in terms of how people are treated when interacting with government agencies or services. And again, asking the respondents whether they or someone they know has been treated unfairly on the basis of race in interacting with state government. The number that really stands out here is the number among Native American and Indigenous respondents, where you see almost 2/3 telling us they have experienced that kind of unfair treatment in interacting with state government, and higher numbers across the board among Coloradans of color, for the most part, than what we're seeing compared to white Coloradans, where fewer than 1/4 indicate that they or someone they know has received that kind of unfair treatment. Now, aside from sort of diagnosing the frustration that Coloradans may feel with state government, we wanted to understand what factors might be driving it. And so we offered the respondents a list of challenges that might keep Coloradans from being heard in state government and asked them to rate each one as either a major challenge, minor challenge, or not a challenge. The red bars on the left-hand side are the proportion that rated each item that we asked about a major challenge, and that's where I think we see the sharpest distinctions. Almost 3/4 indicate that political polarization and lack of compromise between political parties is a major challenge, and more than 2/3 say the same for the strong influence of lobbyists and corporate interests over policymakers' decisions. There is still a majority who views it as a major challenge that state policymakers don't understand the needs of Coloradans like them. The only one where we see less intensity of concern is the one at the bottom of the slide, lack of information about how Coloradans like you can engage in the state policymaking process. Just under half view that as a major challenge. But if we add to those numbers in the red bars, the numbers you see in the orange bars, the proportion who view each of these as at least a minor challenge, it is more than 4 in 5 in each case that say, yes, this is something that keeps government from serving the public as effectively as it could. So there is a broad recognition that each of these items, to some degree, is posing a challenge. We do see some interesting differences here when we look at these numbers by race and ethnicity, as you'll see on this slide. The table shows the proportion that rate each of these items as a major challenge. And when you look at that last item, the lack of information about how Coloradans like you can engage in the state policymaking process, we do see higher numbers among some communities of color, notably Hispanic and Latino Coloradans, where a majority say that they view that as a major challenge. But overall, looking across racial and ethnic categories, just about every item on the slide is something that across those racial lines, Coloradans are saying, yes, this is a problem this is something that limits government's effectiveness. When we look at the differences by income, it's striking here the correlation that we see on a couple of the items. On the top item, political polarization, concern about the impact that has increases with household income, with more affluent households being more likely to view political polarization as a major challenge. But there's a couple of other issues, the two toward the bottom of the slide, limited understanding among policymakers of the needs of Coloradans like you. The lowest income households are much more likely to express that concern, more than 2/3 of them saying that state policymakers don't understand their needs. And then the lack of information about how to engage in the policymaking process also is more broadly perceived as a concern among Coloradans in those lower income households than in more affluent households. And then finally, looking at some of the distinctions and concern about these issues by partisanship, you'll see that it is much more frequent among independent and Republican Coloradans that they perceive that state government just doesn't understand their needs. Among Democratic Coloradans, that number is strikingly lower, 39%, that believe that state government doesn't understand them. Again, I think that's a reflection of people's perception of who's in charge in state government and how responsive they are based on that sort of partisan dynamic. But I think that does speak to some of the political dynamics that we see prevailing in Colorado right now as a result. So finally, we also wanted to understand what solutions or changes Coloradans thought might make things better in the state in terms of how the government might be able to engage more effectively with residents of the state. We presented a list of these new approaches or enhanced approaches that state government might adopt. Ask the respondents to rate each one as either very, somewhat, or not too effective. More than 3/4 rated every item that you'll see listed on the slide as at least somewhat effective, and majorities pointed to 2 as things that they thought would be very effective changes. The first is requiring state policymakers to consider the long-term financial impacts of their decisions at a time when the cost of living and financial impacts are foremost in the minds of Coloradans. Perhaps not surprising that that's something they express that kind of enthusiasm about. And then the third item down, half of Coloradans say would be very effective if state policymakers were required to regularly engage with and listen to Coloradans like you in a meaningful way. And we saw in the last couple of slides some notable subgroups within the state who believe that state government doesn't really understand their needs. Also, broad perceptions that a range of other steps, making more information available to the public, requiring policymakers to think about how their decisions affect different groups of Coloradans, and increasing policymakers' access to nonpartisan information and analysis. All of those are things that Coloradans also think would be effective. And to a large degree, these kinds of changes are ones that are embraced across partisan lines. As you'll see here, the perceived effectiveness of each of these strategies is pretty similar between Democrats, Independents, and Republicans. One place where we see a little bit of a gap emerge, although it's really a gap in the breadth of perceived effectiveness more than the overall direction of that response. Increasing state policymakers' access to nonpartisan information and analysis of issues. More than 4 in 5 Democrats and Independents think that would be effective. Just over 7 in 10 Republicans say the same. So just a little bit more of a partisan gap there. But again, all of these ideas really embraced across partisan lines. A few geographic differences when we look at different regions of the state. Pueblo County, which you may remember we oversample so that we can have a little bit more confidence in the results we obtain in that area. We see even higher numbers on a number of these items among those Pueblo County residents, requiring state policymakers to consider long-term financial impacts of their decision and to consider how those decisions will impact different groups of people within Colorado. But in the big picture, relatively modest geographic differences and a lot of enthusiasm for the full range of changes that we tested here. So with that, we will turn the page and look at healthcare, which, as we saw at the beginning, remains a significant concern for Coloradans. And I will hand it over to my colleague Lori to talk through those findings.
Great, thank you. So just to reinforce, as we've had a few questions in the chat, while we come from different ends of the partisan spectrum, our interpretation of the data is not affected by that. We are looking at this data in terms of how Coloradans responded to a host of questions in a very bipartisan perspective here. So I just wanted to stress that as we walk through some other areas where sometimes people have different policy suggestions, but really the data remains the same. So one thing that we looked at across the years is looking at people's concerns about the cost of healthcare. And while we talked about, especially in our last release, that cost of housing, cost of living has jumped up dramatically in the last couple of years, one thing that has been consistent is that people have long been concerned about the cost of healthcare. In fact, every year we have had essentially 2/3 or more telling us that the cost of healthcare is an extremely or very serious problem. That intensity has climbed up a little as we've seen inflation creep into this sphere as well. But again, today we have more than 2/3, 69%, telling us that the cost of healthcare is an extremely or very serious problem, just a slight bump up from what we saw a couple of years ago. That concern about cost is in part on the next slide because we're seeing that Coloradans are worried that someone in their household could be without insurance. And that is one we saw a clear break 2 years ago. We were hovering around 1 in 4 Coloradans telling us that they were at least somewhat worried that someone in their household might be without health insurance coverage. That jumped up 10 points last year and has stayed relatively the same this year, where we have 37% of all Coloradans telling us that they are concerned they or someone else in their household could be without health insurance coverage. Now, unfortunately, that is not an equally shared concern in the state. What we see on the next slide is that Coloradans that are in lower income households are far more apt to say that they are worried about someone going without health insurance coverage. So if you look actually at the very bottom of the slide, with those in the highest income brackets, 15% are saying that they in fact are worried, but it's 4 times higher among those in the lowest income households in the state. And then obviously there's some distinctions as well by racial or ethnic categories. For Native American and Hispanic or Latino Coloradans, a majority are worried that they or someone else in their household might be going without health insurance coverage in this next year. So big concerns out there, especially among some specific subgroups. And we can see that that has actually changed over time. On the next slide, those lower income Coloradans are really the groups where that has jumped up in the last year. So an 11-point increase in the very lowest, and then a 6-point increase among those in the $30,000 to $50,000 income range. So real concerns evident there. And that's having some real impacts in terms of how Coloradans experience healthcare in the state. On the next slide, we've asked for the past 3 years, Coloradans to tell us whether or not they have postponed medical or dental care at any point in the last 12 months. And while it's bounced around a little bit, we've basically seen around 2 in 5 Coloradans tell us that, yeah, they've put off that type of care over the last 12 months. 38% today are indicating that, about the same as we saw in 2021. So if we go to the next slide, you can see that among those who have, there's some groups that really stand out in that underneath that 38%. In fact, we have majorities of, again, those in the lower income brackets, whether that's household incomes under 30,000 or in the 30 to 50,000, renters, LGBTQ Coloradans with a disability, and then the overwhelming majority of Native Americans as well, telling us that they have had to postpone medical or dental care. And I said that in the context of the cost of care, because that's what Coloradans themselves told us. On the next slide, we asked them specifically why those that had postponed care had done so. And you can see that cost was the dominant concern. Basically, people telling us they couldn't afford care, it was too expensive. But even if you drop down a little bit, some people, even with insurance, talking about high deductibles or co-pays, that's another 6%, or just generally concerns about the cost of living and bills they have to pay, another 4%. So that bumps us up another 10 points. In fact, 56% telling us that they've had to postpone care simply due to cost, far more than in any other category in terms of insurance coverage or just not having the time or concerns about COVID and the pandemic. So cost really driving that behavior. And you can see a few of the specific comments that we elicited from respondents and captured here. But one I'll point out too is we had one of our more sophisticated respondents telling us that the cost and availability of culturally competent providers was their rationale for postponing medical, dental, or mental health care in the last 12 months. And you can see on the next slide that when we asked people to tell us if they'd been treated unfairly when it came to seeking healthcare services, here in Colorado in the last year, because as a result of their race or ethnicity, we had about 1 in 5 the last 2 years telling us that in fact they had had that experience. It was 22% this past year. Predictably, there are dramatic differences based on the race of the or ethnic background of the respondent. We had 44% of Black Coloradans, a third of Hispanic Coloradans, and nearly a majority of Native American respondents, and 2 in 5 multiracial respondents, telling us that in fact they had felt like they'd been treated unfairly as a result of their race or ethnicity when seeking healthcare services. So a clear distinction there in terms of that particular experience. I mentioned mental health care, and again, that's an area that we've looked at every single year since the inception of this survey, and one where we have seen change over time. When we've asked respondents to tell us how big a problem is mental health in the state, you can see we went from a majority in that first year during the height of the pandemic to now over 2/3 telling us that mental health is an extremely or very serious problem here in Colorado. So it's gradually inched up over time over the last 4 surveys that we've conducted here. And when we've asked about personal experience with this issue, we've really seen some sort of shocking numbers here. We have a majority, 57%, that told us in the last year they've experienced mental health strain themselves, whether it's anxiety, depression, loneliness, or stress. But look at these subgroups. We have over 3/4 of young women, nearly 9 in 10 LGBTQ Coloradans, just the vast majority of a number of different groups. Not surprisingly, unemployed Coloradans, those dealing with personal crises, those who are having to live with a family member or friend, for example, who aren't renting or own their own home. So lots of people experiencing some instability there, also telling us they've experienced mental health strain. So clear concerns there in terms of those personal experiences. And what are they doing about it? Well, unfortunately, we also saw folks that are postponing mental health care as well. We talked about medical and dental care, but we saw in the last 12 months that 1 in 4 have told us that they postponed receiving mental health care. Not surprisingly, it's lots of the same groups that told us they've experienced mental health strain that are telling us, unfortunately, that they're postponing mental health care. So not a good combination out there in terms of people that are having to push off some of those mental health care experiences. So what are they doing, and are they talking to anyone among those who said they've experienced mental health strain, which again was the majority of Coloradans? They are reaching out to friends or family members, and they could say multiple responses here. So that's why it adds up to more than 100%. And a third said they talked to someone who has had similar experiences. Only 2 in 5, though, said that they've talked to a professional healthcare provider about that. And I think the smallest number here is the one I'm most concerned with, the 14%. That's like over 800,000 Coloradans, really, if you extrapolate it out, who said they've talked to no one but are experiencing mental health strain. So a really concerning little number down there at the bottom of the slide for those who are sort of suffering silently right now and not talking to even friends or family members about this concern. So what can we do about these issues? Well, we asked Coloradans on the next slide to tell us their response to how effective a number of different actions could be that might improve mental health or healthcare in Colorado. You can see that more than 3/4 say that each one of these could be at least somewhat effective if implemented. Making it easier for people to receive mental health screenings and services at the same place where they get care for their physical health. That was the most widely received. 86% said that could be very or somewhat effective. But not far behind is pairing mental health professionals with law enforcement when they're responding to mental health emergencies, or increasing government investments in programs outside of healthcare settings that seek to prevent mental health and substance use challenges. Again, more than 3/4 of Coloradans feeling like that could be at least somewhat effective in addressing these problems. Those three issues are also well received across the partisan divide here. You can see we saw at least 3 in 5 Republicans, more than 4 in 5 independents, and 90% or higher Democrats feeling like each one of these interventions might be something that could improve mental health or healthcare in the state. So that was a lot of data. I will pass it to Austin to talk about how you can access even more of this data, because we have it broken out in lots of fun and interactive ways.
Thank you so much, Lori, and thank you so much, Dave. I do just want to briefly touch on our data dashboard. This is one of the, what I think is one of the most helpful tools that we produce of Pulse. The nice thing about Pulse is that we're able to dig in deep on all of these different issues and concerns based on race, ethnicity, income level, age, partisan divide, things like that. And the way to get to that interactive dashboard, I will just quickly share my screen. If you go to our website at copulsepoll.org, you can see the results in the interactive dashboard by clicking on results. If you scroll down, this is our interactive dashboard. You can explore the data. Of course, my computer is acting a little slow. You can explore all of these issues with the menu onto the top right corner. If you click into any of these, you're able to see the questions that we asked, the percentages. But the nice thing is that if you say want to know how Hispanic or Latino respondents responded particularly to these questions, all you need to do is click on Hispanic Latino in the left-hand side, and you can see that these percentages changed. You can also do that with political affiliation. If you want to know what Democrats responded to for these questions, those also change. And then you can get into a little bit more of the weeds by clicking multiple of these. If you ever want to reset this dashboard, you can go here at the bottom and click reset, and it will go back to how all Coloradans responded to those questions. So this is one of the best tools that I think we offer at Pulse. If you scroll down a little bit further on this page, this is where you can get all of the information that we've released thus far. So we have a presentation of all of the results here, the full questionnaire and top lines, crosstabs, as well as key insights based on some of the other issues that we've been releasing. We've also will include all of the recordings on this page as well. One other thing that I wanted to highlight on our website that is new this year is our data and resource hub. Now this offers shareable tools and resources for you and your networks. We will have toolkits and fact sheets available, as well as shareable social media graphics. You're able to kind of scroll through these, and there will be more of these available shortly. You can share them on Facebook, Twitter, LinkedIn. You can email them, or you can download them as well. if you or your organization may be interested in requesting your own presentation, you can reach out to us by clicking this button here. And then we also have resources for journalists, media, and researchers. So I would highly suggest that you check out our website and play with the interactive dashboard, as well as use all of the resources that we produce for you in our data and resource hub. So I think we can now jump into our Q&A session. I know that we have received quite a few questions in the chat. We've tried to answer as many of them as we could during the presentation, but I do just want to bring back Dave and Lori, and let's jump into our first question. One received is, I'm curious about combing through the Larimer and Weld County, since politically they are different. Is separate data available for these counties?
Unfortunately, we don't have a large enough sample size in those counties individually to look at them with a great deal of precision, which is why we combine them, although, as you note in the question, there are some limitations in doing so. But again, as Austin noted, for any of the different demographic or geographic breakouts that you might be interested in looking at, the dashboard provides a great way of sort of slicing and dicing the data to learn more about it. So that county split, unfortunately, is one that we probably can't accommodate with a lot of reliability, but there's lots of others that hopefully will be helpful to you.
Dave, another question we received from L for mental health was lack of resources, such as knowing where to find a provider, lack of provider access, wait lists, etc. Were any of those mentioned or asked in the survey?
So we, in this survey, we didn't have a detailed questioning around factors that might limit access to mental health, but we have done that in previous year surveys. We had open-ended questions where we asked people to tell us what they saw as the biggest barriers, and it was all of the things that you just listed. So we do have some data on that topic that's a little bit more granular from some prior year surveys.
We did ask an open-ended question of why they've postponed medical, dental, or mental health care. And 75% of respondents did say that the reason why they postponed some of those services was related to cost and the ability to pay for those services.
Yeah, and Austin, I believe people can access last year's data as well on the website. So not to bury everyone in even more numbers, but there's a top line there that walks through the last year's numbers. I have so many screens open right now that I'm not able to pull that one question up quickly, but yeah, but it's something that's easily searchable too.
Yes, thanks for flagging that, Lori. On that results page, you are able to see previous years. There is a drop down, so you can see all of the results from 2020 up until now, as well as one other thing that our website does is completely bilingual. So you are able to choose English or Spanish for the website. All right, let's hop into another question. Do you have a way to look at these survey results specific to the responses of adults 65 plus? I saw you looked specifically at young women, and I'm interested in older adults in particular. I'll go ahead and get that question. Yes, we are. We did break down the age ranges this year a little bit more in detail. That is not, we did combine those ages in the interactive dashboard, but in the crosstab document, you are able to see specific age ranges that are more narrow than what we have in our interactive dashboard. let's see, what other questions do we have? We did have one question in the chat that I think was answered, but if you all could talk a little bit about how we weight the data and what weighting actually means.
Sure. So we strive to interview a diverse and representative set of Coloradans. As I mentioned at the beginning of the survey, or at the beginning of the presentation, we know that there are some subsets of the adult population that, just because they're relatively small in number, will not be represented in large numbers among the survey responses. And for that reason, there's a number of subgroups that we do additional interviews with, as we noted at the beginning. African American and Black Coloradans, Asian American and Pacific Islander Coloradans, and Native American and Indigenous Coloradans among them, and also residents of Pueblo County. What that means is we have more interviews with Coloradans in those subgroups than we would get if we just interviewed a natural cross-section of the population. And what that means is, if we want to look at the data as a sort of accurate picture of the real population distribution in Colorado, we have to statistically weight the data to mean that those groups where we have extra interviews, we essentially count each individual interview a little bit less as part of the overall data set, which means that when we look at it by race and ethnicity and age and gender and all these other factors, the data looks like Colorado as reflected in census data. And it's also the case that when we do the interviewing, occasionally we'll have a few extra interviews or too few interviews with one subgroup or another. And part of our process is to look at the data carefully, make sure that no group is over or underrepresented, and use that statistical weighting to account for any minor differences that might emerge.
I'm seeing a few more questions about kind of the methodology of the survey. Dave or Lori, maybe you can talk a little bit about, one, how we kind of choose folks to interview, how we actually do conduct those interviews by phone and online, how we reach out to them, and how do folks who may be undocumented, how do they get selected?
Yep. So our methodology is to take a random sampling of residential addresses within the state of Colorado, and within each household, randomly select an adult member of the household to participate in the survey. We use a variety of different tools to come up with methods of contacting people within the households. We call them on landlines, we call them on wireless phones, we send them email messages. If we can find an email address for residents of the household, we send them text messages, and failing any other method of contact, we mail them a postcard in the US mail with a link through which they can take the survey. We don't ask any questions about their citizenship status as part of qualification for the survey. Any adult resident of the state is eligible to participate, and we strive to get as diverse a selection of adult residents as we can. And that's part of the reason that we do the survey using those multiple modes of outreach. There are some people who answer a phone call from a stranger, but they might respond to a postcard they get in the mail. Vice versa, some younger people, I know my own children, for example, will respond very quickly to text messages, but rarely look at their email. And so again, just trying to be as flexible and multimodal as we can be in the survey helps us to get as diverse and representative a sampling of the state's population as we can.
Great. We also received some questions about what does the data set look like for LGBTQ plus respondents, particularly transgender or non-binary identifying respondents?
So I think we highlighted a few places where those subgroups really stood out. For example, experiencing mental health strain, that subgroup was one of the highest in terms of responding, that they experienced anxiety, stress, loneliness. There was a fourth one that is escaping me right now, but that generally that was one of the groups that we saw was a clear concern In terms of policies to address some of those things, they were also some of them more likely to indicate support or feel that those things could be effective in terms of addressing a concern that was widely shared within that population. But in terms of other aspects, I think that like many Coloradans, they were more concerned about the cost of living, cost of housing. There was definitely some, strong sense that some of the policies that we tested there could be effective in terms of addressing those problems. Trying to remember if there were any other areas where that subgroup really popped out. David, anything else come to mind?
No, I think you touched on the big ones, but for LGBTQ plus Coloradans and for subgroups within them, including those who identify as transgender, those who identify as LGB, those who identify as non-binary, we have the ability, I believe, Austin can correct me if I'm wrong, on the dashboard to segment respondents by those categories. And if you're curious at looking at any individual question in the poll and how those subgroups responded, you can find that data. I will note for some of the subgroups, it's a pretty small subset. 2% of our respondents identified as transgender, for example, which just means there's a relatively small number of individuals on which the data will rest. Again, this is probably one of the better data sources that's available to understand public opinion across many of these categories among Coloradans. So we encourage you to explore and see what you can find on the dashboard. And if you have any further questions, please reach out to the foundation. We're happy to tell you what we can find.
Yeah, and I'll also say that when we get to those very, very small subgroups, sometimes that can just mean that our margin of error is pretty massive for that subgroup. And so we may not want to highlight it or put too much in that bucket, given given that we don't want anyone to sort of extrapolate too much from those subgroups. So when we're talking about, people who just moved here who are left-handed and, I mean, sometimes we can get into really tiny groups of people that as pollsters, we don't feel quite as confident in addressing those individually.
We have time for a few more questions. An additional one we got, and I might bring in my colleague Kyle in to answer this one. Curious as to why Pueblo was selected for oversampling. Kyle, would you be able to answer that?
Hi, good morning, everyone. I'm Kyle Rojas-Legleiter from the Colorado Health Foundation. Pueblo is an interesting case when you think about sort of commonly used quantitative data sets that are available to describe the experiences and perspectives of people in Colorado, where as a county in and of itself, it's kind of just below the line through sort of base model random sampling methodologies. It's kind of just below the threshold of being able to break it out on its own without doing an oversample. And so as a result, in many other quantitative data sets, it's lumped together with neighboring communities, whether that's the San Luis Valley, the Eastern Plains, El Paso County, and all that as well. So we decided for Pulse for the last couple of years, just to bump up the sampling that we do for Pueblo County specifically, so that we're able to report data for Pueblo County on its own. But that also has impacts for some of the surrounding communities and regions of the state, where oftentimes Pueblo is lumped together with them. So while we're able to report about Pueblo County just by itself, that also means we're able to report on El Paso County just by itself as well, or the Eastern Plains without including data from Pueblo in sort of representation of the experiences of people from Eastern Plains in Colorado or other regions of Southern Colorado as well. So we've done that for the last couple of years with Pueblo County, and we're able to break down the data specifically for Pueblo for that reason. But thank you again, everyone, for participating in today's conversation. We really love these questions about the data, and we're trying to get to as many of them as we can. So appreciate it.
I've seen a few more questions about the dashboard in particular, asking if you can choose additional age ranges, genders, things like that. You are able to select multiple within the particular subcategory. So if you say wanted to know how Coloradans responded who have less than $30,000 income, but then also wanted to see it go one more above that, up to 50,000 a year. You are able to select those and group them that way. Again, the more you select sometimes does decrease the sample size and our confidence to be able to compare that to Coloradans overall. But you are able to select multiple of those subcategories and kind of compare and contrast on your own. As well as if the interactive dashboard may not be for you, you can use and really get into the weeds of it and go through our crosstabs document. It is a PDF on the results page, and you are able to see kind of how anyone responded to any question based on any racial, demographic, anything like that. So those are available. Few more questions. I see one coming from regarding transgender individuals. Again, I believe in the dashboard we did combine non-binary and transgender. So that is the one that you would select. Basically, the way that we asked that question was whether or not they just identified as transgender, and it was, I believe, a yes or no response. Dave, Lori, feel free to correct me if I'm wrong. I think that is all the questions that we have received in the chat that we have not really answered. So Dave, I am actually gonna ask you to bring up the slides again and show what is coming next. We have been releasing this data in multiple phases this year. We have one last public presentation that will be in September. It will be on September 19th, starting at 10 a.m. And this is, we're really going to do a deep dive on all of the responses from folks who identify as Hispanic or Latino. Really encourage you to sign up for this presentation. It will be presented in Spanish with live interpretation in English. So you can register for that in the same link that you've registered for any of our previous presentations. Again, always want to make sure that you feel free to reach out to us with any additional questions, concerns, any thoughts that you may have. I think that is pretty much it. We will be sending out the recording, all of the resources that we presented today, as well as signups for the next presentation in a follow-up email shortly after this. So thank you all for joining us today. Feel free to reach out if you have any other questions. Thank you so much, y'all. Have a great day.